Thank you for viewing this educational program. This module discusses living with an artificial urinary sphincter. Please note that a separate module reviews the indications for the artificial sphincter and the implantation procedure. The AMS 800 artificial urinary sphincter device is controlled by a pump which is placed in the scrotum. This pump requires manual dexterity to operate. Initially, after surgery, it will be tender, but this improves with time, and eventually you should be able to operate it with ease and comfort. In essence, one simply has to pump the pump when you want to urinate, and that is all the interaction with the device that should be required. At all other times, pressure in the fluid-filled system will keep the cuff inflated and the urethra closed off to prevent leakage. To begin to understand how to operate the device, first familiarize yourself with the different parts of the control pump, as shown on the diagram here, including the hard upper part, the soft lower part that you will pump, the deactivation button, and the tubing arising from the upper hard part. You may stand or sit to urinate at your preference. Stabilize the device with one hand by gripping the tubing just above the pump. Then squeeze and release the soft part several times with your other hand. Some men are able to do this with one hand as they get more experienced with it, but you should learn how to do it with both hands. Here is another detailed view to show you where to stabilize the pump. Again, when ready to urinate, squeeze and release the soft part of the pump a couple times with the other hand. Squeezing the pump moves fluid out of the cuff and temporarily into the pressure-regulating reservoir balloon. This opens the cuff temporarily, allowing the bladder to empty urine out of the urethra. After urinating, the cuff refills within a couple minutes by pressure. No action on your part is required. Normally, one should avoid pushing the deactivation button. Deactivation is almost never required. In those rare cases when it is, however, follow these steps. First, squeeze the soft part a few times as you normally would to urinate, and feel the dimple of it as it slowly refills. Before it becomes completely refilled and the dimple is lost, press the deactivation button firmly. A very slight dimple should be left in the soft part of the pump. To reactivate the device, use one hand to grasp the tubing above the pump and hold the pump in place. Use the other hand to give the lower part of the pump a quick, forceful squeeze. Squeeze the soft part of the pump several times as you normally would before urinating. Your device will be deactivated after implantation surgery, and your doctor or nurse will most commonly reactivate it at your office or clinic follow-up visit. As noted, it is very rare otherwise to have to deactivate it. Certain patients may be advised by their doctor to deactivate it at night or in other circumstances. Of note, it must be deactivated prior to insertion of a catheter. The device may be accidentally deactivated if the deactivation button is pressed while pumping. In these cases, two scenarios may play out. First, if it is deactivated with a full pump, the cuff will also be full and you may find it difficult to urinate. In other situations, however, if it is deactivated with the pump empty, the cuff will also be deflated and you will probably experience continuous leakage. The next two slides address each of these situations. If the lower, soft part of the pump feels harder than usual and you are having difficulty pumping it and/or difficulty urinating, the device may have been accidentally deactivated. In this case, secure the pump with one hand, then with the other hand, give the lower part of the pump a quick, forceful squeeze. You should feel it release. Then squeeze the pump several times as you normally would to urinate. You may experience some discomfort while activating the device. Contact your surgeon if you cannot activate the device. If the device is deactivated and the pump feels hard and squished in with a dimple, you may experience continuous leakage and have difficulty pumping it. In this case, stabilize the pump with one hand by gripping the tubing just above the pump, and squeeze the sides of the upper hard part. Use hard, steady pressure. Then squeeze and release a few times as usual. Again, call your doctor if you are unable to get the device working properly. It is important to warn other medical providers before being catheterized. The device must be deactivated to reduce the risk of cuff erosion caused by traumatic catheterization through a closed cuff. If you have elective surgery planned where you might require a catheter, advise your surgeon who should consult a urologist for guidance on device management. It is recommended that you wear a medic alert bracelet and also consider carrying a wallet card with instructions to first responders or other healthcare providers in the event that you have a medical emergency and are taken to hospital by ambulance. Along with any trouble using your device, you should call your doctor if you have trouble urinating, if you have blood in the urine, if any parts of the device are showing through the skin, or if there is redness or swelling of the skin over any device parts. The artificial urinary sphincter can successfully restore urinary control after prostate surgery. In this module, we have reviewed how to manage your device at home. It is important to contact your surgeon if you have any concerns about the function of your device. Thank you again for viewing this presentation.